We know cardiovascular disease affects all Americans, and it's currently the #1 killer in the country. And this is especially true within the Black community, and both for Black men, but in particular Black women. One of the biggest challenges isn't that this disease disproportionately affects us, it's that awareness is so low. About 1 in 3 Black women realize that cardiovascular disease is the most likely thing that's going to kill them. And we really need to start to make those first steps to get in touch with our doctors, get in touch with our healthcare providers to know what our cardiovascular risk is, know what our health is, and then start to make changes. And some of the biggest risk factors that we want to know about and you should speak with your doctor about are your weight, your diet, your blood pressure, your cholesterol levels, if you have diabetes, and your family history. If you have a lot of members in your family who've experienced heart disease or have their risk factors, which may affect you. It seems like one of the biggest drivers of this is what we call the socioeconomic determinants of health, and that's the social and the political and environmental factors which affect our health.
This is pretty typical of what people have access to just walking up in their neighborhood.
A lack of access to COVID testing and vaccinations has become another battle for minority communities.
Every police shooting of an unarmed Black person leads to worse mental health for the entire Black population in the state in which it occurred for the next 3 months.
It has as much to do with access to having a good doctor who can help control your blood pressure, access to good foods that can help you keep the weight off and have a healthy lifestyle, and even things like stress. We know that chronic stress over time on its own can have very powerful effects in your body that can even increase your blood pressure. All of these factors together have sort of conspired to make this problem not just a problem the whole nation faces, but we as African Americans disproportionately face and really have to work together to overcome. That said, we know that this can be overcome, and we know that there are a lot of people who've been able to make changes to live a healthier lifestyle, but it may not be easy, and the next steps in figuring out how to do that is something to talk with your doctor and talk with your healthcare provider about how you as an individual can really start to make changes to live a healthy lifestyle